Lord, just be with us, Lord, as we go through these procedures today. Help us to make good decisions, Lord, and help us to get along with each other as we go through the procedures, Lord. And Lord, bless the sick and the shut-in today, and be with us as we continue our work for the nation. Thank you, Lord. Thank you for everything. Amen.
Next, we have roll call.
Bradley Cobb.
Honey.
Janelle Fulbright. Here. Bill Anglin.
Here.
Bill John Baker. Jack Baker.
Here.
Harley Buzzard.
Here.
Julia Coates. Here. Joe Crittenden. Jody Fishinghawk. Here. Meredith Fraley. Here. Don Garvin. Tina Glory Jordan. Present. Curtis Snell.
Here.
Chris Soap.
Present.
David Thornton.
Present.
Kara Callan Watts.
And next I need to discuss the approval of the May 13th minutes.
So moved.
Second.
I have a first and a second. All those in favor of approving the May 13th minutes, signify by saying aye.
Aye.
Any opposed, same sign. Motion carries. Next we have reports. First up from the Claremore Service Unit, I believe Marty Smith is not here, but we have Vicki Snell and Travis Scott, so I'm assuming you're Vicki Snell.
I am. I'm the Hospital Administrative Officer at Claremore. Nice to see all of you. Good morning. Just some things to start off, letting you know what we've been doing. One of our pharmacists, our PharmD, has received the IHS Junior Pharmacist of the Year Award for his work in pharmacist-managed congestive heart failure clinic. We have a very good clinic that he and Dr. Martinez work together on and manage those heart failure patients, and he has been recognized IHS-wide for his work and contributions to that program. And just some notable things from Travis's side. Travis Scott, as you know, is our ambulatory care director and has been with us for 90 days now. And in that short time, we're already seeing some notable accomplishments that he's achieved in our outpatient setting. His first function was to look at our walk-in clinic, our general practice clinic that sees adults patients that don't have appointments. You know, that was where we were struggling. We felt like that it needed some attention, and Travis has done that in the past 90 days, and he has made some changes. He's established a nurse leader to conduct the patient flow through that clinic, and as patients come in and walk in and utilize the system, he's making sure that they're getting the medical triage that they need, and more importantly, we're able to get those people through the system. He's looking at the flow problems that we've had. People sitting there waiting on just nothing but referrals. He's making sure that those processes, back to work statements was another issue that people needed to go through the system to get, something to go back to work from their physician. So he's streamlining a lot of things in that flow, and we're seeing more patients, and that's exactly what we felt like would happen. He's also implementing a new appointment system in July, and hopefully once we get things lined out in that clinic, he'll start looking at other areas in the hospital. And another one that he and I have had discussion about is the emergency room. So we're looking at things. We hope that people are seeing the improvements. I think they are, because certainly complaints are down, because I get to hear the complaints. And I think we've made some accomplishments in that area. And then yesterday we set out to deploy the electronic health record into the emergency room. We'll start with our physicians and nurses, making sure that they come online, come on board with the system, and all of our implementation team is working with them to make sure the transition is good. And because as you know, when you transition into an electronic system, it's a little slow at first, so our patients are going to be, and that's a critical place. So we're going to have to work together to make sure that we see all of those patients. Some vacancy announcements. We've hired a new family practice physician, Sherry Peterson, and she'll begin on July the 7th. And then the job announcement for our OB/GYN Chief of Service will close on June 17th, which is today, and we'll have a new physician chief for the OB. What will also be coming out in the near future is a vacancy announcement for a chief nurse of OB. So we'll have 2 new leaders of the OB service coming in and looking, because we are making changes. We're going to look at more staffing. We're going to start the epidural service. So looking at, those future enhancements for our OB program. And I'm sure all of you are curious about our vacancy for a CEO. It has closed, and there will be interviews held this week, and hopefully we'll have a new CEO by August 1st. So I guess that's about it. Claremore, unless you have any questions.
Are there any? Councilor Fulbright?
How many people applied for the CEO?
I don't know. They had to apply to the area HR program, and all that process was done at the Oklahoma City level.
Councilor Buzzard?
Yes, Ms. Snell. What kind of changes are you making with the phone system there?
Travis, you want to talk a little bit?
Well, what we've seen, we have a lot of walk-ins coming in the morning. We also had, over time, a development of a lot of appointments right at 9 o'clock and 10 o'clock area, so we had this big bottleneck. That was making the walk-ins stay longer to be seen in the afternoon. So the changes we've made is we've spread those appointments out over the whole day, and we're trying to free up more providers to address the walk-ins first thing in the morning. So it's the same number of patients, and actually over a month's time, a few more appointments, but it allows more providers to address walk-ins early in the morning instead of us bottlenecking everything in the morning.
One more follow-up. How many providers do you have currently?
Medical staff as a whole, or just in that clinic?
No, and as a whole.
I think there's about 35 positions, but they're not all filled.
What about just the clinic part?
How many do you have in that clinic?
In family practice, we have 6, with the one that will be coming on in July will be at 7. And that they're not all physicians. 2 of those are mid-levels.
So it's a good mix,
Thank you.
Any other questions? Okay.
Thank you very much. I thought you had one. I'm sorry. Next from Hastings is Mr. McElmore, Ed McElmore.
Och så är galen. Jag ligger den här är dålig då har sig. Austin is done dagen this is low. Good morning everybody. This is Mr. Chairman, members of the committee. It's good to be back. We skipped last month, I think. We had other commitments. I'd like to first point out the content of the report you have in front of you. We have a few recent developments and some announcements, future plans, and then we have some data on the visits. Our financial status report is on page 3 at the bottom half of the page. Our collection report is the top of that same page. We're as of yesterday, broke $24 million for this year. We have 3.5 months left in this fiscal year. So we hope that we're going to make our goal of $34.3 million, which will put us about $1 million above last year. If we don't, then we're still in good fiscal shape. On page 4, I included a bio of our new director of the Indian Health Service, Mr. Bob McSwain, who was confirmed by the Senate and sworn in just last month on May 7th. There's some information about him. He's been in the Indian Health Service for a long time. He's worked his way up the ladder, and he's now the director who replaced our Dr. Charles Grimm. and we think he's got a lot of good ideas to move forward with the agency in. There's some general operations information on page 5, a snapshot of Hastings. And then the following pages, about the next 10 pages, we thought were some interesting data about the Cherokee citizens who access Hastings. The registered patients living as of today, that first column tells you the Cherokee citizens from all over the country who access Hastings Hospital. And we've estimated that of the total number of Cherokee citizens who access Hastings, about 20% come from Cherokee County, and about 80% thereabouts come from outside of Cherokee County. I know Councilmember Jack Baker and Julia Coates have some constituents, even in Hawaii, I think, who access Hastings. There's some from 29 Palms Marine Corps Reservation, for example. We've got 3 Cherokee citizens come from California to access services at Hastings. So I thought that was a bit of information that would be helpful for you to, when you start to draw a picture of the services that Hastings provides and to whom we provide them. Some recent developments: we had a site visit from the American College of Obstetricians and Gynecologists on June 3rd. They came in and took a look at our OB services, and they had a few minor recommendations and some things that right now we would be hard-pressed to address, such as space expansions and that kind of thing. Of interest to this committee and council, we announced way back in January, I think, that we had hoped to have our mail order pharmacy up and running. Well, because of post office regulations and having to work through payment mechanisms and all of that, that's pushed us back. But we do now have a target date of 1 week from today. We're going to start up, and we're having to call it a refill by mail program because of some concerns about the mail order aspect of it that some of our payers have questions about. So we're resolving that by simply referring to our program as a refill by mail option that patients may have. We've opened the enrollments up for that, and as I said, June 24th is our startup and go live. We're going to start shipping medications to people, and maybe some of those folks in 29 Palms in California may actually be able to get their meds by mail. We've not limited that to the local area. We will mail those medications to wherever the patients live. Our lap banding procedures, we hope to have up and running. We had targeted June as our start date or start month. We're trying now to arrange for the site visit of the proctor who has to oversee the first 3 procedures and then release the chief surgeon, Dr. Ballou, to continue on her own to do those. And that's being worked on now. At least the proctoring piece of it. We have an annual Joint Commission self-assessment that's due on June the 21st, this coming Saturday, but of course we'll send that in, I guess, on Friday, the 20th. And then we'll set up a follow-up conference call and get some technical assistance from the Joint Commission Standards Interpretations Group. And any issues that we may find in our compliance, we identify ourselves and develop corrective action plans to address those issues. There's some items on the agenda, the calendar that you can see. The direct service tribes meeting is scheduled for August the 5th through the 7th. They have dates now, and it will be in Spokane, Washington. If any of you are interested in participating or attending that meeting. Mr. Chairman, I'd be happy to answer any questions.
I believe Councilor Fishing Hawk has a question.
You said 20% come from Tahlequah?
Well, Tahlequah, Cherokee County, yeah.
What percentage come from Adair County?
You know, I started to do that calculation, and I didn't complete it. But I know there
About 10% roughly?
yeah, a big number from Westville and Stillwell, I know, and
Yeah, I'm not even factoring that. So I'm saying about a third of your people, your bids come from Adair and Cherokee, don't they?
yeah, probably in that neighborhood, yeah, somewhere in that neighborhood. There are a big number also from Sequoyah County, Sallisaw, for example, 4,130. Rowland, 647. Fair number from the Muskogee service, or Muskogee County in that area, Spavinaw, 440. But that's what we have in our records.
Could you figure that out and get that to me? I'm just kind of curious.
Okay.
And the second question is, what do I need to tell my people that's wanting to use your mail order pharmacy? What do they need to call and what do they need to do?
Well, we have a little form, and it's about a half-page form. They simply fill out and confirm their address and indicate that they would like to receive their refills by mail. Now, they'll have to come back in, not on that 30-day cycle, but on whatever schedule the physician requires.
Copy of the form they fill out
Yeah.
so I can hand it out to
Yeah,
them?
we'll do that.
Councilor Buzzard.
Yes, Mr. Brackmore.
Mhm.
And do you know the percentage of the patients that live out of jurisdictional boundaries that use Hastings?
We didn't do that calculation either.
What do you think it is? Is it pretty high?
It's, well, I mean, it's high in terms of actual numbers, but in terms of the percentage of people who access, I wouldn't say it's real high.
I see Arkansas, UNK, 4,675.
Yeah, it's an unknown community, but we know they're from Arkansas somewhere. Yeah. I point these things out to indicate to you that Hastings actually provides services to a whole bunch of folks from, I think we indicated before, 75 of the 77 counties in the state of Oklahoma, some from Kansas, Missouri, Nebraska, you know, on and on. I think we even have some from New Hampshire in here, New Jersey, of all places, to come to Hastings.
How long was their wait time?
Councilor Jordan.
Chairman Cobb, would this be the appropriate time to announce our public forum and ask Mr. McLemore to provide that information to all the employees of Hastings, that they're invited to come to that public forum?
I think the date may be appropriate. There will be a public forum on June 26th at 6 p.m. Regarding the negotiations and the process of the Cherokee Nation in Hastings. Some of the semantics and details of that we're still working out, but June 26th, and I believe that we've decided that's going to be at the what is the name of that room?
The
Community Service Room behind the restaurant. The details will be worked out a little bit later, but there will be a meeting, a public information meeting.
Yes.
June 26th, 6 p.m.
And Mr. McLemore, would it be possible for you, once we have that information framed, to provide that information through your email system?
Yes.
At Hastings Hospital to all employees?
Yes, we can do that.
Plus, because this is a public forum and we would like all public input, would it be possible for us, once all the information is framed, to ask you to properly place that information in a public setting there at the hospital, so if any patients would like to come and have input, that they would be able to do so?
Yes. We also received information, a flyer about a meeting today or something. Isn't that correct?
We are also having a community meeting.
Okay.
Mr. Baker and myself, tonight at 6 o'clock, music starting at 5 o'clock, eating at 6, with tables from each department to answer any questions that any of our constituents might have.
Okay.
And we would welcome your employees, patients, if you could get that information out. And I believe we talked to one of your associates back in the back about providing that information through your email system today, if that would be possible.
We'd be happy to do that.
And of course, everyone here is invited, and we would love to have you tonight.
All right.
Mr. Baker is in charge of food and indicates we have plenty of food. I think every hog in the county is hiding now, hoping that they can get past tonight.
Mr. Baker is next on the list, so I'm sure he's gonna...
And we will be drumming up some business for you. We'll have fried hog, fried fish, fried bread, fried taters, and homemade desserts, so.
There may be more business if you provide the entertainment.
Hastings Shade will be doing that for us.
Councilor Buzzard.
I don't know if we can get this information or not, but I'd be curious to know if we can have a breakdown of employees there at Hastings, tribal employees versus other employees, non-native, UKB, Cherokee, Creek. I'd like to see that, if that's possible to see. I don't know if you can get that.
You know, I'm not sure that that's an item that is open for... I know we can give you the name, we can give you the title, we can give you their salary, and I think there's only about 4 things that are considered to be public information in the federal system, but we'll look and see what we can provide. Yeah, okay.
If you can.
Okay.
Any more questions from Mr. McLemore? Yes.
Is she just going to send that to us on email, or to Gail, or Shelley, or what?
I didn't hear you, I'm sorry.
My request to break down the percentages by county?
I took that as he was going to have that for you. How do you want it?
I was about to say, can you just send it to Shelley?
Okay.
Thank you.
You got that, Mr. McLemore?
Yes.
Okay. Councilor Fulbright?
I'm wondering, do you envision us having some sort of, I don't know if you would call it incentive or a way to promote the New Three Rivers Clinic? We've got all these people living over there, and if we could give them a handout when they come into Hastings, saying, you know, you live close, you know, you can save all this. We're not getting very many people over there, and it's such a nightmare up there. I mean, there's so many people from Muscogee County. I try to tell them to go to Muscogee also, but they're used to coming up here and they don't want to change.
Yeah.
I mean, I can't say that it's relieved us any yet.
Yeah. Well, we can provide information about the availability of services at Three Rivers, and but as far as encouraging people not to use Hastings, I mean, I wouldn't go that far, but I could indicate that there are alternatives available in the event they need quicker services, maybe. I mean, we have a number of complaints. I think we had 43 complaints last month that related to the availability of a primary care provider. And the reason is because of the limitations on numbers of providers and space and time for the scheduling of appointments. And so that may be an option for them if they wanted to have a designated primary care provider for them to access Muskogee.
Well, I've been trying to get the word out down in Muscogee County because it's hardly any farther for them to go to Three Rivers and just come up here, but they're used to it. They just keep on coming up here.
Yeah.
I don't know how we can re-educate them to go somewhere else.
we'll explore options there.
Any more questions for Mr. McLemore? Well done. Next, Cherokee Nation Health Services, Melissa Gower.
Good morning. You have my report, and I'll answer any questions about that. I also wanted to take just a minute and recognize some health services staff. The Employee Appreciation Day was held, I don't know, a week and a half ago, I guess. We had several health staff that received attribute awards there. The J.B. Dreadfulwater Award, which is Employee of the Year, was given to Cynthia Sturgis, a registered nurse at Bartlesville Clinic. The Susan Bluebird Award, which is for Respectful, was given to Cheryl Hill, Supervisor, Public Health Nursing at Nowata. The Committed Award, which is the Shelby Washington Award, well, that's not a health one. Wayne Wallace Award, Cherokee Way of Life, was given to Mary Peters from the Diabetes Program and Health. The Myron Taylor Award for Leadership was given to Rhonda Cochran, who is the Regional Clinic Director. Clifford Hendrickson Award, Self-Confident, was given to Rodney Sumner, Health Information System Administrator. And the Nellie Taylor Award for Responsibility was given to Lori Hogner, MIR at Wilma P. Mankiller Health Center. And then also the Oklahoma City Area Indian Health Service gave out their awards, or giving them out in July in a ceremony in Oklahoma City. And there were several Cherokee Nation Health Services individuals that received those awards, as well as some from Hastings and Claremore. For Cherokee Nation, the Salina Health Center received a Tribal Award, Kathy Smithson. The Bartlesville Clinic, Cynthia Sturgis, received a Tribal Award. Dr. Cheryl Gann from Redbird Smith Health Center received one. Vicki Mata from J Clinic, Sam Hyder Health Center received one. Ann Jones from the Three Rivers Health Center. Mary Becky Cheney from Bonita Health Center. Deborah Ketcher from Wilma P. Mankiller Health Center. And Katie Branham from Will Rogers Health Center. Carissa Kiffmeyer from Cherokee Nation received a Tribal Merit Award. The Exceptional Performance Award for Non-Clinical was Sean Terry from Cherokee Nation. And George Long from Cherokee Nation received the Area Director's Lifetime Achievement Award. And J.T. Pathery from the Cherokee Nation Health Legislative Office received the Area Director's National Impact Award. So we had quite a few of health employees to receive various awards this summer, so I just wanted to recognize them. And then not included in your report is an update on Hastings negotiation process, and I'm just going to give that. The negotiation process, you know that we've been in that process for about a month or so now. We just recently completed 8 days in Oklahoma City, and you had very good representation. Mr. Jack Baker from the council and Doug Evans participated for 4 of those days in the negotiation process with us. There were we received almost all of the information that was outstanding. We've gotten all of that information. We have narrowed it to about 3 outstanding items, and we're going to have a negotiation conference call this Thursday morning to try to complete those, and there's a possibility we'll have one more meeting to complete those if necessary. And I just wanted to not only thank Mr. Baker, but Meredith also participated some. Bill John Baker participated some, and Dr. Cobb, Ms. Watts also participated some. So we thank you for participating in that process with us. On the human resources, as you know, there were, with the current staff at Hastings Hospital, there was three options that people were able to choose from. One was for commissioned officers, which could be on a memorandum of agreement, which means they retain their federal employment and benefit systems. They remain a federal employee and they're just on agreement to the tribe. We had 45 of those people to sign an intent saying they wanted a memorandum of agreement. The interpersonnel agreement, which is the same thing only for civil service employees. We currently have 240 that has signed an intent for an IPA. And tribal hires, Cherokee Nation hires, we have 189 employees that have accepted a Cherokee Nation tribal hire. On funding, we have all of the funding tables have been updated. Vicki Hamby worked very hard on those with area office and found lots of mistakes, and we've gotten all of those corrected, and we're in agreement on those. There's still one of the outstanding items is on the buyback services, which means that if there were contracts that Indian Health Service had at Hastings that would be beneficial because of a price, mainly for IHS to continue those contracts and we buy them back, then they would charge us an administrative fee to do that, and that is still an outstanding item. We did receive another proposal from them today, which is more in alignment than their first proposal, so we're going to consider some of those costs on buyback services. All of the funding agreement, contract support cost is still outstanding, but it looks like we're getting close to reaching agreement on the language on that. Let's see what the other item. And so our continued process is that we'll have the call on Thursday. If needed, if we don't reach agreement on those three outstanding items, then we'll have one more face-to-face meeting with them. If we still don't reach agreement on an item, then we will submit a final offer, and that will go to headquarters office, and they'll make a determination. So that's the process that we're in now, and that's kind of an updated on. I'll be glad to try to answer any questions that I can about that, and Mr. Baker may be able to give more. Did I leave anything out of big? And also, I wasn't here last month, but there was a request in the minutes that I went through to have a chart on the third-party collections by clinic, and so I brought that today. If you want to take one of those and pass it around. Thank you. And I guess that concludes my report.
Any questions for Ms. Gower? Councilor Jordan?
Melissa, how many employees do we have at Hastings?
Let's see, there's... Just a second. Let me add these numbers up. 34, 38, 43, 24, 65. Looks like 594 approximately.
Okay, so we have 594 employees, and we've only accounted for 474.
That's correct.
either through IPAs or through tribal
MOAs or
employment?
tribal hires.
What
That's
about
correct.
all the rest of them?
Okay, there are 4, I'm glad you asked, I happen to have that. I ran that before I came over here, because I was doing the same thing, there are 4 commission corps officers that we've not gotten anything from, and we're exploring those now. I don't know if some of those might be on assignment somewhere, if they're on extended leave, if they just haven't, responded or what. So I'm not real sure why the reasons are, but I can tell you what the categories are. So there's 4 commissioned officers that haven't responded.
We don't know whether those are doctors or not.
I don't know that off the top of my head. Do you know?
They're not doctors.
They're not?
No.
They're not. 34 permanent civil service employees that have not made a decision yet. And those were permanent civil service employees that were offered an IPA, but they wanted a tribal offer also. And so we sent them a tribal offer, and we've not gotten anything back. And that could just be they haven't had time to respond to that yet. There were 5 permanent civil service employees that we're still trying to get more information from IHS, and I'm not sure what the information is. It could be retirement or severance or whatever until they make a decision, but they're undecided. And there was 29 permanent civil service that falls in the same category with the 4 commissioned officers in that we've just not heard anything from. And those could be some that are like on extended leave, on workers' comp, on, just not there for now. And so I'm sure that those will start straggling in. There are 18 temporary employees that received a tribal offer that have not made a decision yet. And there were 30 permanent civil service employees that chose to take a tribal offer instead of retaining with the federal government. And also, I've been working with Oklahoma City area office and with Hastings, and we're trying to ensure that all the temporary employees, the majority of the temporary employees could even have an option. We're trying to convert those temporary employees to permanent so that if they wanted to retain with IHS, they could do that. And the last I talked to the HR person in Oklahoma City last week, is they told me they think out of the 176 temporaries, I think, that they may be able to convert 140 of those.
Don't they have to do that conversion by July 1?
I'm not sure.
Ed?
But I know that they're advertising and...
No, they
No. No.
I know they were trying to convert a lot of temporaries to permanent.
Right, they are 140 of them is what she told
And the
me.
information I had been given is that had to be settled by July 1.
I want to make sure we're clear on this, because the answer back there was definitely no. Is that correct?
Ed?
Please, go right ahead.
We have 2 kinds of conversions going on. We have some folks who had previously been permanent for 52 weeks or longer, who were eligible for non-competitive conversions. And those can be done almost at any time. We have vacancy announcements that have to go out to compete positions, and we're announcing 1 vacancy. But if there are 10 people in that category, for example, all 10 can apply for that 1 vacancy, 1 position, and we'll hire all of those 10 as permanents if they so choose. Now, we're targeting June the 25th, July the 1st, to complete all of that, because we're having to make sure that the IPAs and all of those things are processed before the reduction in force announcements are done which have to be done 60 days in advance of the transition. So July 1 is not a real firm date, but that's a target that we would like to have all these actions
But that's
completed
not a
by.
cutoff date.
It's not really a cutoff date, but we would certainly not want to, I mean, it's like cramming for an exam in college. I mean, most folks wait until the very last minute, and we're trying to avoid that kind of thing.
Would that be where the 18 temporary employees that have made no decision might fall?
There may be some considerations there that would require that they make some decisions by that time. I don't know what specifically the 18 are.
Because I've been told that some of these conversions
Yes.
are being held up. Do you know anything about that, Mr. McLemore?
I have no idea where that may have come from.
Can you check to make sure that those are all being timely processed?
Yes. Yeah.
And could you, Melissa, enlighten us, not by the next meeting, but within the next week, by our email system through Shelley, could you enlighten us on these 120 positions, not their names, but what the positions are, so that we can identify them?
These that I gave you the individual numbers on, is that what you're referring to?
Yes, I've got, by my calculations, we have 120 that are still outstanding on
Okay.
decisions. And I would like...
What you want what their status is, I mean, why they haven't made a decision or...
What their status is, what their position is. I don't know if it would be proper to even ask for their name, but I would like to find out why there hasn't been something done to reach out to those folks to settle the issue of their position.
Okay. Well, there has been lots done to reach out. And just this week, and that's why I say these numbers are going to flow, but just this week, Hastings staff has gone through and are going to individually go find out what the issue is. Because I really think that some of them are people that's either not there. I think Kathy told me she found already that some of them are people that were on 30-day emergency hires and they're not there anymore.
Well, a concern to me is that we have 20% of the employees still out there in no man's land. I mean, that's a fifth of our workforce by these numbers. That's a fifth of our workforce that we don't know whether they're even considering coming over. And in the health field, that's very critical. And I would like to know their positions, because certain positions are absolutely critical.
Right. I understand that, and I feel the same way, and that's why we're working so hard to try to
there's a lot of
ensure
unknowns
that we...
here, that I hope you can enlighten us as to what's happening to those individuals, because this is not like some of the other things that we've tried to assume or compact. The health field, there's a critical shortage of people in the health field. And if you lose individuals, they may not be replaceable. I know that over the years I've seen the tribe assume a lot of federal operations, but never have we tried to assume the operations of an area that has such a critical shortage of professional staff. And I think that we need to proceed very carefully on this. Not only do we need to be watching the financing to see whether we'll even have proper financing to consider this action, but this is an area where we better be considering these employees' thoughts, because some of them may not be replaceable. Not replaceable in the near future, providing a critical shortage there at the hospital for us. And it's something that we need to look at, and we need to look at closely and follow closely.
I can assure you we are.
Councilman
And I will get
Buzzard.
you more information on these as we develop that. And we already know some of those, I just don't have the names and
If you
stuff
can do
on
that
them.
within a week, I'd certainly appreciate it.
I definitely can do
Councilor
that.
Buzzard.
Yeah, my questions are a little bit different, and she answered some of the questions that I had. But Melissa, I was just looking at this third-party collections, and I noticed all of our clinics are above on the FY08, except the Guiding Clinic and the J Clinic. And then I also looked at Hastings on third-party collections and looked at our clinic on third-party collections. Hastings shows about 18,000 patients, and we're showing 27,000 patients, but we're less than $10 million on that. Are we not really pursuing the third-party collections at our clinic as hard as we should?
Well, there's a lot of difference on billing issues, and I can't give you specifics off the top of my head, between an inpatient hospital and an outpatient clinic.
I understand.
So it's not apples to apples. But yes, we pursue very rigorously, and I think if you look at our numbers comparatively for a lot of years for total collections that I've been providing every month, you will see that every year we have exceeded our increase in collections.
I think that's what caught my eyes on this chart is everyone has an increase except the Guy Clinic and the J Clinic. And it just kind of caught my eye since everybody has an increase except those two.
And a lot of that is, the reason it's hard to do this for 6 months and hand it out is because you're 30 to 90 days behind in billing and getting revenue in, fixing things. So it's really hard to project what it's going to be at the end of the year because of deposits and all those kinds of things until you actually get to the end of the year. And every year at the end of the year we have exceeded our expectations on collections.
The other question is, it has to do with the roof, and I'm not sure, should I bring that up now? It's the roof at J. I saw Mike quit in here a while ago, but I'm just concerned. I'm happy that we're getting a new roof. I'm really, really happy about that, but it's just the leaks up there. And what it does to our, not only patients, but our employees. I'm concerned about that. Because it's been leaking up there for several months, and we're already getting the mold and getting the smell in there. But with the rainy season, we just had it rain, and it just seems like that we're not trying, or the contractors, I guess, are not protecting what they're doing up there. I went in there the other day, and we had buckets to try to stop it, but still, you have water splashing down, you have patients, you have employees walking up down the hall, and we're gonna get somebody hurt up there. I suggested putting tarps on what Purlington had on the roof, but maybe that's not feasible to do. At least try to save what we've got. I hate to see. I got a report from one of the clerks up there the other day that we had tarps covering the medical records. Those big shelves, and they have a lot of them, I understand. And we had tarps covering that up. It's just. I know it's aggravating with as much rain. I'm not griping so much about the rain, but I just wish we'd...
Actually, that's what we need to be griping about, because it's really hard to put a roof on when it's raining.
Protect it, get the roof on, and I understand they told me the roof is going to come like the 23rd or 24th, so we still have a few more days, but I'd just like to see the contractor put something over there to keep the rain out. I'm sure they probably...
I know that Sean went up there yesterday and met with the contractor again, and they're staying on top of it and assuring it's, as dealing with the situation as best as possible. But I understand. It's not a good situation.
Councilor Fishingham.
I just got 3 quick questions.
Okay.
Is the OBGYN one of the departments that she touched on that wasn't talked about, or have y'all talked to the OBGYNs? And all
You mean the physicians?
over it?
Doug?
I visited with each of the physicians in the OB-GYN.
Could you?
I'm sorry, this is Dr. Doug Nolan,
Right.
and he's the medical director, or clinical director, I think.
Chief of
Chief, what he is. I just know I deal with him. The chief of staff at Hastings Hospital, so maybe he can answer that question.
I've talked with each of the obstetricians there at Hastings. Now, we are two physicians down, and that's been prior to any of the negotiations. Basically, all the 4 right now have indicated to me that they are planning on staying. Now, they're busy and they're anxious to see what's going to happen, but I have received no indication from any of them. I visited with each of them personally that they have any intention of leaving.
And I know that Dr. Grimm has visited with their, what do they call, what's Dr. One?
What is it? He's the chief
I know.
of the OBG.
The chief of the OBGYN department, and he has lots of ideas and is excited about some opportunities that he'll be able to address in his department.
Okay, is there a recruiter in our budget for the clinic?
We submitted a recruiter for, currently we have a person that is not in a recruiter position but is doing recruiting for us part-time. But we did submit for a recruiter in the '09 budget.
But there wasn't one in last year's.
There was not a full-time recruiter in health. Human Resources had a full-time recruiter, but there wasn't one specifically for health.
Okay, my other question, the 34 things that Melanie gave us on a spreadsheet of the financing, have all of them been addressed, or can you update us on them at some point in time? Or send them to us, better yet.
Yeah, I can send it. I think you're referring to the task list, is it, from IG?
On the outstanding items?
We can email that out with updated to you.
Where do you want that emailed, Council?
To Shelley again?
Shelley?
Okay.
Are there any more questions for Ms. Gower? Madam Speaker?
It's not about the dental clinic.
Is it about dental at Salina?
That's because you've already asked me about that.
I'm still unclear on the financial planning for all of this takeover attempts. Have you had an opportunity to meet with Callie and Doug and I guess Jack and Brad in regard to financial planning to give us a better overview or maybe a little more detailed overview of the financial planning of all of this, into all of this?
Okay, I'll answer it and then I'll let Melanie add if she has something. Doug and Mr. Baker both were in all of our negotiations process, have went over all of the funding tables in detail. Doug has been involved in all of those funding table and questions, and I think he got all of his questions answered and went through that process with Vicki and our financial consultant.
Okay.
Through that process, and yes, we've met with Callie numerous times. Probably once, what I would think is once that we get finished with all these items, then we probably need to set back down because we've now done a budget, a draft budget and submitted it, because we wanted it to come over in the overall tribal budget packet for.
So you're not at a point where you can share that with us yet, Jack?
Well,
The tables can.
yeah, we can share the tables.
Okay.
Sure.
Maybe that would help clear some of the confusion in my mind.
Okay. Do you want to add
exactly where we
anything?
are financially.
And in fact, I would add that, we should probably talk about the draft budget as well, because contract support and IDC and the implications on the IDC pools and things like that, we probably want to talk through with Doug before we actually submit the comprehensive budget. So I think we're at a point we should do that.
Yeah.
Okay.
Okay.
That'd be great.
Okay, sure.
You want to handle that through E&F?
Yes, we will.
Okay. Speaker, is that it?
Thank you.
Is that it? Councilor Jordan?
Yes, Melissa, are you all addressing the estimate of needs for the facilities in terms of improvements that the facilities are aged, the equipment is aged? Has there been work done in the area of estimating the needs of both the facilities and the equipment? What money will have to be put into both things by the tribe in order to bring them up to where they need to be today? And are you addressing, I understand that facility there would remain a federal facility, so we're limited in what we can actually do to the facility itself. Has there been talks and discussion opened up on a transfer of the entire facility to us and what this cost might entail in terms of the hit our budget will take? Because we're going to come up on a budget process here in the next 3 months. What kind of hit will our budget take in order to bring that facility up to where it needs to be now?
Okay. The discussion, one is that it takes and I don't know the exact months, but Melanie might know, but it takes a long process to transfer title to federal facilities. For example, our clinics at Sallisaw and Stillwell are still federal facilities. Those have never been transferred to the tribe. And so we knew...
May I interject? Have those facilities been upgraded?
Yes. I mean, we do things to them all the time. And I'll get to that in a minute. But we knew that it would not be possible to transfer title to Hastings from federal property to tribal property by October 1st. Also, there are a couple of projects that IHS is doing that's in the process now, a chiller replacement something, and a removal of underground storage tanks. And so what we thought would be best is if we left it federal property, and then we'll start the process later, but until we get those projects finished and are able to get in there and actually do a full estimate of the needs. We initially did that, and I think in the very first report that I did about Hastings, I gave a sheet of paper that had some impact numbers on it, and I don't remember those off the top of my head. But that was just a rough review and estimate. So we decided, that's why we decided to leave it federal for now, and then we would start that process later. Equipment and facility upgrades. I think, and I can let Mr. McLemore add to this or correct me if I get it wrong, but previously how they have kept their equipment updated and their facility needs is through a couple ways. One of those is just through M&I funds that you receive from Indian Health Service, which we also receive and are eligible for. And the second is through carryover third-party revenue. And so they have been able to, keep the facility where it's operable and up to date. I mean, I don't think the facility is in real bad shape. There are still some things that we would want to do, just for sure, just, maybe put a new coat of paint on and do some things that with the flooring and some things like that. There is a list of equipment that they give us every year that they need to assist with the implementation or expansion of any services, and we try to help them get that equipment. There is a list now. For example, I think he was talking about the help clinic and the lap banding. We assisted them with that. Also, their current diabetes clinic that they built out of third-party revenue in their physical therapy building, we bought all the equipment for that facility. So those items are continually looked at and updated, and we will have a more comprehensive list of the facility requirements. But yes, we've talked about all of those and have included the majority of that in the negotiations process.
Could you, within the next week, with that same email that I requested on the 120 employees, give us like I'm sure you and Mr. McLemore probably have a 5-year needs for equipment there and the approximate cost. Could you enlighten this body as to what the approximate cost of those needs will be over, say, the next 5 years?
Is some of that redundant because it would be in the budget that Madam Speaker talked about?
For 1 year. What would be in the budget would be the 1 year for '09. I don't want to commit something I can't do in a week.
Well, what you believe the needs might be over, say, the next 5-year period. I'm sure you all have a 5-year plan for the facilities.
Let me see what I can come up with.
And just email that to Shelley so it can be emailed to the remainder of the council.
Councilor Baker, I believe you were quicker to the hand there.
I would like to add to that, and a possible funding source, whether it would be from the federal government or from third-party collections, or if we would need to fund it through the general fund.
Councilor Soap?
Yeah, I don't know if Melissa's the one to provide this information or county. Can we get like a year-to-date operating cost for each of the 9 facilities that you're overseeing, just to...
The clinics?
Right, just
Sure.
a year-to-date operating cost?
Yeah.
Not detailed,
That-
just overall,
okay.
is that...
I can get that for you, but that would be in your budget book.
Yeah.
In
I
your,
mean, that's the budget?
those are broke out
That's
by,
the actual operating cost by the clinics? Each
Well,
facility,
it's-
Or is it total? I can't remember.
it's by clinic, isn't it? Yeah, it's by facility, yeah, yeah, yeah. And if you need something in addition to that, just let me know, I'll be glad to get it for you.
Are there any more questions for Ms. Gower? Thank you.
Thank you.
Next on the agenda is old business. I see that we have none. Oh, I'm sorry, Mr.
Actually,
Beck.
I would like to commend the negotiating team for all their hard work and their long days, 10 to 12 hours of negotiations frequently each day. And particularly Vicki Handy for her hard work of going through all the tables and finding the errors and making corrections. And she worked frequently another 6 hours in addition to the 10 to 12 of those. I appreciate all their hard work.
My understanding, the Secretary of State had to get a little tough there for a while.
Yes.
Councilor Kellen Watts.
I just want to reiterate Councilman Baker's statement. The team did an exceptional job, and I was fortunate just to be there a short period of time and not have to endure the hours that they spent. And you know, for being a corporate person coming into a bureaucrat's environment, it was very interesting to see how we were treated or not treated, and I appreciate the endurance and the persistence that you showed on behalf of the Cherokee people, because I absolutely believe this is the right direction to head. So thank you for making that possible for all of us. Thank you, Mr. Chair.
We are to old business, and there is none. Actually, our esteemed financial, yes.
Thank you, Mr. Chairman. I've been watching the meeting, working on trying to get the mod package over for signature from what changes were made last night. So although I haven't been sitting in here, I've been listening into the conversations. And I wanted to take an opportunity, with your indulgence, to comment just real briefly on those negotiations. When I sit there for 4 days, for hours listening, although a lot of the information sounded Greek to me because of all the acronyms of the health-related industry that just, you know, I'm sitting there trying to go through a learning curve. But one thing I did pick up on is that without sitting there and listening and participating in it, one may not get an appreciation for this. But the federal health system and the Indian Health Service, although they may have been at the table trying to get the negotiations to move from A to B on a whole variety of issues, whether it's funding related, personnel related, direct service, care service, whatever it is. Watching the Cherokee Nation team negotiate with this other party was very enlightening when it comes to how to obtain the necessary information to make decisions with. There was so much information that without it, the team would not be able to stand before this body and give you any assurances. And I can tell you what I've witnessed is there's a lot of assurances that this team is going to be putting before you in the next month or two that I can tell you was not easily obtained. The information was not easily obtained to come to that conclusion. Although still, to this point, I'm still trying to digest and process a lot of information that is new to me professionally. I mean, I'm just not used to dealing with this type of information. I can tell you that it was an educational experience for me, and I appreciate the opportunity, but I did want to comment on the team that they put together. I think the administration put together a very competent team. They did a wonderful job of analyzing the data, analyzing the numbers. They're going to, obviously there's going to be a large sharing of information with this body, but I can tell you that to get to the point where they can avail that information to this branch of government is not an easy task. I just wanted to comment on that. Very professionalism was handled in Oklahoma City. They had some extremely competent consultants at their side that was very impressive. And I just wanted to share that with the body because I know that a lot of you I haven't had an opportunity to talk to through this process, and I just want to take that opportunity, and I appreciate the time, Mr. Chairman.
Thank you. Madam Speaker.
I have a question, Doug. Are you comfortable with the financial planning process of all of this? Are you at a point where you can say yet?
I'm not at a point where I can say yet.
Okay.
I'm still trying to process.
Yeah, because I requested some information from them. All right, so you'll be working with them.
I still have some questions too, but I'm getting more and more comfortable. I'm getting a lot of my questions answered, and at the same time, I'm learning more. And the more I learn, the more questions I have. So
You're comfortable with the process so far. All right, we are moving to old business now, which there is none, and we have new business. And Councilor Buzzard has patiently waited to talk about his resolution under new business.
Yes, I had introduced a resolution to rename the Sam Hyder Clinic in Jay. The old name used to read the Sam Hyder Community Clinic, and I believe to stay with the health department's naming, we want to rename that the Sam Hyder Health Center and change that out. So I'd make that in form of a motion to change it.
We have a first and a second. All those in favor of changing the name of the Sam Hyder Community Clinic to the Sam Hyder Health Clinic, yes by saying aye. Aye. Any opposed, same sign. Resolution passes. Next we're to announcements. Are there any announcements?
Community meeting tonight.
Community meeting tonight. Any more announcements? And I would entertain a motion to adjourn.
I move to adjourn.
We have first and second. All those in favor, say aye. Aye. Any opposed? Okay. We are adjourned. Next meeting is tentatively scheduled for July 15th. Come back to the